Welcome everyone. Today's topic is developmental milestones, and I am going to take you this topic through a flip class. Flip class is that I am going to present this video to you. You can review at your own time, at your own pace, at your leisure time, and can learn about all these aspects which are covered. And during the lecture time, we'll discuss about what are the developmental milestones, your queries, your problems, and we have a lot of interactive activities between the sessions. So before I begin my presentation, I would like to disclose that this presentation is not my original copy, but it also consists of some of the videos from various organizations like CDC, American Academy of Pediatrics, and Indian Academy of Pediatrics. And due care has been taken to appropriately acknowledge their contribution in the today's presentation. By the end of this, as you can see here, these are the learning objectives that you should know the importance of the milestones. You should be able to assess the milestones in major areas, recognize the major milestones, and identify the red flags or importance of the delayed in the developments or risk factors which may indicate a delayed development, and understand the value of the screen test. Over 2 decades since the identification of the developmental behavioral psychosocial problems as a new morbidity of the pediatric practice, and it has a because of the profound societal changes which has influenced the private practice, and now we are more concerned about including the rather than in the institutional care of these children or identification of these children to the community, and also we are trying to involve them into the mainstreaming. That is the mainstream, the routine activities which are there of the day-to-day person of the routine people. So this is just an overview of the milestones. The one of the important book which we all concerned with the milestones and is considered to be the Bible of the milestone is by Illingworth. In 1987, he said that development is a continuous from conception to maturity, and its sequence is same in all children, though its rate varies from one child to another, and we have to understand this. Child developed being totally dependent newborns to independent individual by acquisition of the skills, and there is a range of the normality of the acquisition of these skills. And development, important aspect of this development is that development follows a pattern from the cephalo to the caudal. The milestones which are related to the head and neck and eyes and ear will come first, followed by the trunk and the lower limbs. One of the principles of the milestone assessment is that listen to the parents very carefully, and we have to see the child again a second time if there is some abnormality detected, and there should be opportunistic pickup. That is, when the child is coming from some other problem, we will try to pick up those child having abnormality, and the state of the child should be taken into account. We have to distinguish between the developmental items reported and those observed. The parents may report, and we have to be very careful about their concern, and then we have to also observe these milestones. Routine child surveillance includes the newborn at the age of 6 to 8 weeks when the child is supine, at 6 to 9 months when the child is sitting, and when the child is a toddler between 1 year to 3 years, and finally the communicating child between 3 to 4 years. Development milestones are usually assessed in a 4 fields sequence of development. That is the gross motor, which is concerned with the locomotion, the vision and the fine manipulation, that is development, the eye and hand coordination, hearing and the speech, and personal and social. That is what is related to the integration of the acquired abilities to reflect understanding of the environment. You can see this video.
Today we're going to go through communication milestones during the first 2 years.
This is intended as a public service video.
Its
goal is
to provide parents with the information that they need in order to monitor, nurture, and really encourage their young child's communicative potential. Each of the age groups we look at, we're going to look at 3 different areas to tell us how communication skills are developing. We're going to look at social engagement, attention to language, and communicative effort. So starting with that 7 to 8 month old. A baby of that age is a highly social creature. Some of the signs of social engagement are a baby lighting up, really engaging when spoken to, making strong eye contact, sharing a smile and a vocalization. Referencing back refers to looking back at somebody to help make sense of a situation, a baby playing with a toy and looking to see somebody else's reaction to what they have before them. And then there's imitating, beginning to do what they see others around them doing. In terms of attention to language, baby's been paying close attention to everything that the adults in the world have been doing.
Anna, look!
And what are those adults doing? They're doing a lot of talking. Yes. One of the first things baby is paying attention to and making sense of is often their name.
Julian.
When a baby this age hears their name, they should look up. In addition, if the baby has been introduced to and expected to follow commands with a gesture, come to mommy, give it to daddy. This is an age where they are able to follow those early first commands with a gesture. In terms of their own ability, to communicate what it is that they want and need. Even before that first word appears, a baby this age is highly communicative. The signs of communicative intent are making strong eye contact, vocalizing, giving a general gesture in the direction of what the child wants. Now we're going to look at 12 to 15-month-olds. What do we expect in terms of social engagement?
A book.
They engage in more reciprocal exchanges.
You want more?
Longer so-called conversations back and forth. They initiate more. The all-important point emerges. That's a way to direct somebody's attention elsewhere. They also are in a position to understand another's point. They can follow their mother's point to another activity as well. In terms of attention to language, in this age group, we're seeing babies able to understand a lot more language and follow commands without that gesture to prompt them.
Good job.
Now, when you say bye-bye, baby will just pick up their hand and start waving bye-bye, carrying out the gestures to songs they know.
People on the bus go up and down.
Pointing to body parts.
Where's the baby's nose? Beep. Yeah.
In terms of the baby's own ability to communicate, it's a very, very clear communication when a child points at something that they want. And now, parents have been waiting a long time for this.
Dad's on the phone. Yeah.
Often, those first words also appear. Now we're going to look at 18-month-olds. In terms of their social engagement, these are kids who now are not only engaged and imitated and initiating, they're pointing and directing people's attention elsewhere, and they're using that a lot to show.
See my blouse?
Showing is a really social skill. When you demonstrate to somebody, oh, look over there at that train that's going by, or the dog, and look back at a parent, you're initiating a real social exchange. In the area of attention to language, the toddler can follow many and more complex commands. The toddler has the attention span at this point to engage with a picture book and go back and forth reciprocally with the adult, pointing out the things that are labeled or things of interest. In terms of their ability to communicate, we have words to indicate wants.
You need bubbles.
Those same words will now also start to emerge in terms of pretend play.
Oops, ouch.
They'll try to narrate, maybe start to make the sounds of the baby sucking or the car moving. We're getting vocalization coordinated with pretend play. The 24-month-old is a social sophisticate. She is a ham. She wants your attention and she knows how to get it.
Where is the city?
Where's the city?
At the park.
At the park.
At the
This child's social engagement is demonstrated in that forum. She's wanting to show you everything, engage you constantly, all the time. In terms of attention to language, they understand everything around them.
This way?
Yeah, I think that way. That looks like the top.
They understand complex directives.
Uh-oh. Should we wipe it out? Do you need a cloth to wipe it?
They understand other people's conversation.
There we go. Is that all better now?
And then in terms of their own communicative ability, they should have a vocabulary that's 200 words and growing. Demonstrate many two-word combinations or longer.
He has nails.
He has nails?
In addition, they're using that language for a wider range of purposes. Now it's not only to make requests, it's to direct the activities of others, it's to comment, it's to say they don't want to do something.
Do you want to feed them now?
No, you feed
Me?
And they're bringing that language to their play as well. Play, pretend play really takes off.
What do you think they like?
pasta.
Pasta?
Look how far our toddler has come in 2 years. We've clearly seen that those first words don't emerge out of the blue.
Bubble.
There are many things we can monitor along the way to feel assured that things are going in the right direction. I want to emphasize that there's a range of normal development. Children do things at their own pace. If the child is demonstrating some delays, we need to ask ourselves certain questions. Are we dealing with a hearing impairment? Is this a concern regarding cognitive development? Is this a language impairment? Is this a sign for autism in this child, among other things? And we know from the research on early intervention that the earlier we intervene with each of these difficulties, the better the outcome. So we're urging you as parents to bring any concerns you have to your pediatrician. You know your child best, and you're your child's advocate.
So we have seen in this video that how you can assess social and cognitive milestones of a child. Broadly again, to review, the milestones can be divided at birth when the baby is held in a prone position. Then the hips are high, knees are under the abdomen, and they usually kept their flex posture. At 6 to 8 weeks, they smiles to the maternal overtures, fixes and follows the mother's eyes and face, and during the proned position, they keep their pelvis flat, hips are extended, and on the ventral suspension, if we give the baby, the head and the legs are pulled down, and for momentary he can lift the head up. At 3 months, the child can holds the head up. There is a good eye contact, and holds rattle in the hand and turns to the sound. As there is a sound, the baby turn to the sound. You can see that social smile of this baby.
Come on, give us a smile. Give us a smile.
So you can see the smile, and as the mother is talking to the baby smiled. When a rattle or any object is moved from face, the baby turns the head to one side or other. Now at 4 to 5 months, the baby tries to reach out for an object. At 6 months, they transfer from one hand to another. They chew, they make babbling sound. They sit with the hand forward, just they keep their hand forward, and they lift the head spontaneously from the supine. At 10 months, there is an index finger approach, that is a point with the index finger. And there is a finger and thumb opposition, that is a pincer grasp. And they can say bye-bye and goodbye. So there, the child can follow when the sitting, he can follow the dangling toy. At 13 months, there is a casting of the objects, walks with the support, and uses single words, Baba, Dada, Mama. At 15 months, he can self-feed from the cup, and they can have some domestic mimicry, that is okay, I'm just making the pot or making the tea. At 18 months, the casting stops and they can make a tower of 3. They walks well, they scribbles. At 2 years, they can join 2 or 3 words together, and they have a vocabulary of 50 words, and they runs well, they climb stairs, they make cubes, with the help of cubes, tower of 6 to 7, and by 3 years they are mainly dry by day, plus or minus night, and by 4 years they are dry by night also. And dresses fully. Now when they climb the stair, they make the alternate feet at the step and climb down. While climb up. While coming down, they just keep one leg at one foot, one step, and they make a very careful treading while walking down. And sometimes when they reach up, then when they look down, they start crying because they are not knowing how to climb down. But at the same time, they rides a tricycle with a supporter. So this is a child who is making a tower of 9 to 10. This can copy circle at the age of 3 years and make a sign of V. The child is able to cut with the scissors at the age of 3 years. Now, some of the developmental warning which may occur at an early ages when there is a family history of deafness or cataract, or when the mother is concerned about the child, or when there is a persistence of primitive reflexes. I have not told you about the primitive reflexes. The primitive reflexes are moro, sucking, rooting. They are present at birth, but they disappear by 4 to 6 months. But they persist, then it indicates there is a cerebral palsy or some other abnormality. Persistent squint. So squinting is normal at birth and for 2-3 months, but that is normal. When there is a discordance in the developmental ability in the different areas, then it is a matter of concern. Or if the child is showing a regression of the milestones, the previously attained milestones now start disappearing, then it is a matter of concern. When we are assessing for the delayed milestone, one we have to correct for the prematurity, and we have to consider some idiopathic causes like families having the same, and one of the other area may be catch up later in the life. Suppose if there is this delay in the speech in one child, it may be delayed in other child also. But otherwise they catch up and there is a normal. When there is emotional deprivation, or when there is intellectual disability, when there is a specific abnormality like if they are blind, deaf or having cerebral palsy, then the milestones may be delayed. But most important is that you have to make for the correction for the prematurity. A premature baby may have a delayed milestones. The common causes of arrested or retarded milestones are emotional deprivation, intercurrent illness, example malabsorption, acute cerebral injury like encephalitis or trauma, seizures which are uncontrolled and prolonged, drugs. Sometimes the excess of the drugs can also cause delayed development. But less common are hydrocephalus, metabolic like hypothyroidism, lead poisoning. But depends on the situation. If there is an area where there is a iron deficiency is there, hypothyroidism may be most important cause. Degeneration because of infections, genetic cause. There are many genetic causes which can give rise to delayed in development. Delayed motor development can be a familial feature. It can be because of environmental factor. Can be a sign of the mental abnormalities. It can be because of hypotonia, hypertonia, neuromuscular problems like Duchenne muscular dystrophy, or bottom shuffler. They are having some peculiar ability to, instead of crawling, they shuffle with the help of buttocks. Or there is a visual impairment. So to summarize, development milestones is an ordered process of development, and there is a range of normality in the acquisition of the skills. Bands of the normality may be delayed. Relevance of the delay varies, and early detection of the delayed milestones is desirable for maximum intervention and for parental acceptance. So this is a video which is from the CDC.
Health matters.
In the U.S., nearly 17% of all children experience some form of developmental or behavioral disability. Recognizing a problem early for disabilities such as autism is key for parents and healthcare providers across the nation. To help children with potential problems reach a healthier future, CDC realized the impact of developmental disabilities and invested in a campaign known as Learn the Signs, Act Early. The program aims to help parents measure their child's progress in terms of milestones that monitor more than just the physical. Parents can gauge how their child develops by how they play, learn, speak, and act.
When a parent is worried that a child may have a developmental problem, there are a number of things they can do. They should talk to their child's doctor, contact the early intervention agency if their child is under the age of 3, or contact their local school district if their child is over the age of 3.
The good news is the earlier parents and providers recognize children that are delayed in reaching a milestone, the more intervention may help them to reach their full potential. All children develop at their own pace, and many reach particular milestones slightly late or early.
A parent may notice that a child is not acting like the other children in their playgroup.
What's a kitty say?
The child is speaking later than their brother spoke. This is a time when a parent should go to their child's doctor.
The age that a child takes a first step, smiles for the first time, and waves bye-bye offers important clues. A delay occurs when a child reaches a milestone at an age later than the average developmental rate.
Now show me with your finger.
By 8 months old, a majority of children turn their heads upon hearing their name, smile back when someone smiles, and enjoy playing games like peekaboo. 18-month-olds can engage in simple pretend play, point to an interesting object, or speak in single words without prompting. By their second birthday, many children speak in 2 to 4 word phrases.
It's Gina's turn. It's Gina's turn.
Where's the baby's nose?
Follow simple instructions, and point to objects or pictures when named.
Keeping track of how she plays, learns, speaks, and acts is really important. Those are the things that you can do as a mom to learn those early signs of child development. Follow your gut, you're the expert in your baby, and you can make a difference by letting her doctor know if you're worried about something that's going on.
Cindy Gray noticed her daughter Catherine reach some milestones late.
Even though other people were telling me that Catherine was fine, it was just that she was premature and very small, I had a feeling it was something more than that.
Cindy Gray acted early.
Acting early and seeing the signs of that something wasn't right with her, and then taking those steps to find out what it was, even though that's really hard to do, made all the difference for her.
To detect a problem early, connect early with your child and observe how they play, learn, speak, and act.
We were so grateful that Catherine was diagnosed when she was, because it allowed us to immediately get her the help that she needed.
If you suspect a problem, act early. If your child's development seems to slow down or your child loses skills, seek a doctor's advice immediately. Most of the time, a developmental problem is not something children grow out of on their own, but with help, these children can reach their full potential.
So this is another video which is showing the milestone of a 7-month-old. So this is another video which is showing the milestone of a 7-month-old baby.
And this little girl right here, at this age, she is about 7 months, and so balance has improved to where she can reach and grasp and maintain her balance. But if I take her and tilt her to the side to just a little bit, she still keeps her balance and can come back up. On the early end, about 6 months, often they may tip a little bit and need a little support. So she's 7 months, she's got good balance, she's playing with toys, and still staying upright. So I'm going to take this. So she should be able to roll and she should be able to be interested in trying to get a toy. She may not be able to get it, but she knows that she needs to move and get over close to that toy. So she's looking around, she's moving. And when I put her right here on her side a little bit, she should easily be able to either roll to her tummy or to her back. So she rolls right to her tummy. So rolling, she'll be able to roll to the right, to the left. And she's pushing up with her arm, getting ready for crawling, which will probably be the next large gross motor activity. So looking at large muscles, gross motor, we're going to look at one more, and then we'll look at fine motor, what she does with her hands. So as I take her and I put her on her back, I'm going to look at her head control. She keeps her head right in midline as I bring her up, so she's developed good head control, which is what she should be doing. Now we're going to look at hand skills. So easily she grabs this toy, brings her right up to her mouth, brings her right to midline, using her right and left hands. If I bring another toy and bring her right to her, she reaches, she's got a grasp, it's called a gross grasp, brings her right up to her mouth. And at this age, remember, a lot of toys go to the mouth, so make sure you use age-appropriate toys where she doesn't choke on them. This is a 1-inch block, which she's easily able to grab. So she's got good hand skills. If I take this and show her something else, she recognizes that I took that toy away. And if I kind of show her the holes here in this little, she sees that. She does some finger isolation, what she should be doing with her hand skills. Some other social things she should be able to, at this age, do some babbling. She may or may not say mama, dada. And the way she'll recognize is with a facial expression. She'll recognize mom and dad, and she may smile. So these are just a few developmental activities that babies should be doing at between 6 to 8 months of age. And if you have any questions or concerns regarding your baby's development, contact you.
Another test which is very useful is what is known as draw a man or draw a person test, DAP test. So I will show you this video of this DAP test. So I will show you this video of this DAP test. This is a good enough draw a person DAP test, and these clear-cut directions are given that if you make the person is asked to make a picture of a person and make the very best the picture you can. Take your time and work very carefully. There is no time limit, but usually 10 minutes will sufficient for young children. And this test is used primarily as a screening device. The drawings of a bright children over more than 2 years or those who have had drawing lessons will result in an invalid evaluation. The scoring is done based on these class A and B. That is a preliminary stage in which the drawings cannot be recognized as a human figure, and class B is all drawing that can be recognized as an attempt to represent the human figure. Each point is scored plus or minus 1 credit for each point is scored, and there is no half credit arguments. As you can see that here if the gross detail shows all these, the points are given 1, 2, 3, 4, 5, 6, and the attachments are shown, marks are given, points are given. And if head details are present, if eyes are present 1 or 2, nose is present 2 point, mouth is present 3, nose, mouth, so all these points are given a 1 point. Clothing, if the clothes are there and hand details are shown, they are all given 1 marks. So based on that the scoring is done, and this is the scoring. The score of 1 indicates the maternal age of 3. A score of 14 is mental age of 6. Score of 27. So a score of 51 will show a mental age of 15. 15 years, 3 months, 6 months, 9 months, 15 years. So based on it, we can estimate approximately age of the child. So thank you all for the patience listening. I hope that some of the things you could have understood, but there are many more things to be learned, which comes with your observation. As more you observe, so in conclusion, we can say that the milestones are the most important, and we have to assess in all the 4 areas. We can make use of the screen test also, but we should understand the limitation of the screen test. And the parental concern and observation and their checklist feedback is as important as our observation, and sometimes we have to use the combination of all these tools to assess the child's disability, and early intervention can help prevent the disability and help in the mainstreaming and also avoiding the problem in the